Welcome to this episode of Breaking Barriers in Collaborative Care, where we aim to bridge the gap between healthcare professionals and patients, providing valuable insights, discussing common challenges, and exploring innovative solutions. I am very excited. Today, I am being joined by Eden Dales, who is a social worker. And I think that social work has a lot of misconceptions, like many of the things we've talked about so far on this podcast. So I'm really excited to have you here with us today, Eden. Thank you so much for being here.
Thank you so much for having me here. And I got to meet you a little bit last time, and I really like you. And I think you're very, very good at what you do, and you're a great listener. So being here a second time is just a treat.
No, thank you so much, Eden. It's been really nice to get to know you a little bit through this process as well, and I'm excited to have you share with folks a little bit about social work and collaborative care models and how we can use them to our benefit in healthcare. So let's kind of jump into it, and we can maybe start with, what is the role of a social worker? Because it's a big one, and I think folks don't really know what a social worker does. When they hear that, a lot of different things come to mind. So if you could kind of wrap up this all-encompassing role.
I'm extremely passionate about social work. I've been a social worker for as long as I can remember, before I went to school for it. And I've been practicing for over 23 years as a registered social worker. And I think it is just the most fantastic profession because the way I see it is we work in the context of reducing stressors for people, and we work in the context of systems. So none of us, we don't function in our mind. We function in relationships. We function in our jobs and our roles and our responsibilities and our communities and the people that count on us. So when we meet clients who are struggling with post-trauma related stress or healthcare challenges, complex healthcare needs, long-term disabilities, new diagnoses, any stressor, we work from like a hierarchy of needs model where until you have your basic needs confirmed, you can't really start to address what goes beyond that. So when people are hesitant to see a social worker in the context of them being a psychotherapist, which we are registered social workers are psychotherapists through the college. First, there's a lot to do before that. I say, well, don't worry. Like if we have to look at your stressors first. We have to make sure that you're getting all the government benefits that you could be entitled to. We have to make sure we're maximizing ODSP for you and getting all the nuanced little nooks and crannies in the system that you could get if you're eligible for. We have to apply for disability tax credit. We have to make sure you have accommodations for school. We have to make sure that you have a doctor that you can see. We have to make sure that your mental health needs are attended to. We have to address the major stressors, because before we address those, you can't go into the deeper narratives about, cognitive distortions and maybe the psychotherapy techniques that work beautifully for somebody who's able to learn that, if that makes sense. So we are there to help remove stressors, reduce stressors, address stressors, and really help the client navigate the complex systems that they might be avoiding because it's too overwhelming, be a witness to their pain, be alongside them on the journey, help them develop autonomy and self-determination, help them come up with the insight and the answer themselves to solving their problems. I use a very strengths-based approach, like many social workers are trained in, to amplify inherent strengths that are not the results of accomplishments or accolades or external factors. They are who you are as a person and what you are capable of. So yeah, that's kind of social work in a nutshell in the context of healthcare. And I think it's responsible of a social worker to address those stressors before they delve into the psychotherapy piece. Because if somebody has financial stress and they're meeting with a social worker weekly, and the social worker is talking to them about these wonderful CBT skills about managing, relationships, or maybe finding what their passions are, but yet they haven't accessed the basic government benefits that it might help reduce their stress. And that's why they're up at night. It's not really going to work.
That's fantastic. And you've opened up a lot here that I want to delve into. But just to bring it back to something you had mentioned, just to kind of clarify for folks, you mentioned the college. So there is an educational requirement for folks who say, I am a social worker. And I think I want to clarify that as well. What college are you responsible to? The extreme amount of educational background you have to have before you can say, I am a social worker.
Yeah.
I really want to highlight this as well.
So we are registered health professionals, and unlike in the motor vehicle industry, the rules under the Financial Services Regulatory Authority, FSRA, insurance companies often say, well, you're not a regulated health professional because the list of regulated health professionals that they have don't include social work. And that's just incorrect because we are. We are part of the college of the Ontario College of Social Workers and Social Service Workers. So social workers either hold a bachelor's of social work and can be registered, or a master's of social work degree. It's a little bit confusing because the range of post education, certification, and psychotherapy training is very different. So you really want to first look for the registration, which means that they hold either a social service worker diploma or a social work degree. And they're currently, like now the college, they don't give us cards anymore like they used to. Now you can just go on the website, look up anybody's name, and it will say that they're currently in good standing with the college. So that means that they'll have liability insurance, which is if, either through their job or through their private practice. That also means that they have to adhere to a set of clinical standards and code of ethics. And it's very clear on the website what that code of ethics is. So anyone who is on the receiving end should be crystal clear on what the roles and responsibilities are of that professional. So if something feels offside, it probably is offside because that's what a college does. It regulates the profession that it's going to look somewhat consistent. And then there's the College of Psychotherapists, which is relatively new, which is wonderful that they developed that because it previously was kind of the Wild West. Anyone could use the term psychotherapist. And at first, before social workers were grandfathered into that college, we weren't allowed to use the term psychotherapist, even if we had certifications in many modalities, postmasters. Anyway, that quickly reversed, and we are now able to use the title psychotherapist. And anyone who does call themselves a psychotherapist also will be registered with that college, and they have a code of ethics, and they have a website where you can check in on what if something doesn't feel right. So it really kind of cleans up what's right now. Coaching's the Wild West. There's no college, there's no regulation, there's no rules. They can recommend anything. They can sell essential oils. They can really do whatever they want to do at this time.
The big social media buzzword right now, the coach.
And I think social
media coach.
Yeah, because people are getting a lot of advice, and the advice is psychotherapy speak. So a lot of young people, fascinating to me how much my kids know about trauma speak and psychotherapy speak. However, it's not therapy, right? So learning is part of what we do. We do educate, but you have to address those pre-existing narratives that come from a whole host of factors: family of origin, cultural, environmental, school experience. So many different pieces make up who we are and what we think, that if somebody's not addressing those and challenging those, and you're just picking up little bits and pieces, lists of strong people or lists of trauma recovery, I think it's a little bit tricky because a lot of the recommendations actually aren't appropriate for certain symptoms, like especially with trauma recovery. There's a lot, like mindfulness is not necessarily the right approach for somebody who's very, very hypervigilant in that state of recovery. That's just a little nuanced example that I wouldn't suggest somebody who's in serious psychological distress try and quiet their mind or do meditation. that would be a big danger to that. It would exacerbate their anxiety. So a skilled professional would know what to recommend for whom. And if we're taking it from TikTok, we're really not being assessed. And I think it's a bit dangerous.
Yeah. And
I love coaching, by the way. I'm not knocking coaching. I'm just saying it's not regulated yet.
absolutely. And I think it just leaves holes for the folks who maybe don't have the best intentions, or who maybe aren't fully educated, who are just sharing things that they picked up. So having that regulated college is, I think, very important to highlight to folks when they're thinking about who they're going to reach out to get care. And
it's protective to the professional too, right?
1,000,000%.
It's so safe for us. I mean, I think it's really risky to be advising people on their life without something to back up.
Yeah,
where you know what you can do. Yeah.
And I think also it highlights what you were saying about the strengths-based care. That's something that's very individualized care. You're going to be looking at an individual for their strengths, and that's not something you can do on a platform like social media. This is something you're going to do with an individual one-on-one over a course of time, not just a 30-second or 60-second snippet. So I think that that's a really important thing to note as well when you're talking about the type of quality care folks should be looking for.
Yeah. And I do think it's a luxury to have one-on-one counseling. I think it is very costly. It's not available to most people. And it usually only happens at a crisis point. So looking at a preventative model would be different. Like, I definitely think they should be teaching these stress management skills in school, and cognitive behavioral therapy tools in school, and strengths-based approach, and all that should happen from an early age. But even with young adults and people that are learning this stuff, it could be wonderful to, if somebody can't afford to see me, I'll say, come to me one or two times. You'll tell me your biggest challenges, and I'm just going to blast you with names and ideas and resources. Like, I have a public resource drive that I share with clients, and I'm always adding to it. And it's my specific recommendations for all the problems that I treat. The books, I won't recommend a book I haven't read. I won't recommend somebody to follow I haven't watched. I won't give a phone number that I haven't tested. I mean, I think that's really irresponsible to just hand out a resource when you don't know if the number still works. You don't know if they have a waiting list of 2 years. You don't know what kind of services they offer. Here's a name, here's a number, it's real. This is how you get in. I have like a decision tree of what to do if you need mental health care and you can't get it outpatient. These are the things that I recommend to people. And I think that people are incredibly resilient and capable. And if they don't have the resources for 6 or 8 sessions with an individual therapist, at least having some guidance as to how to navigate this system that is complex, but here are the tools to do it, and this will get you where you need to go, can help tremendously. So some guidance is required, I think. Yeah.
That's fantastic. And giving folks the tools to move forward on their own, I think, helps empower them as well. You're not just saying you're now reliant on this professional forever, which there are some professionals where that may be the case, but you're saying, I'm going to allow you to have tools so that you can feel like you're a part of this as well. You're guiding yourself to.
Absolutely. And that's the self-determination nothing heals us more than doing for ourselves.
Yes, exactly. So you talked a little bit about connecting folks with maybe other resources or other professionals. Are there certain areas where you find collaboration works really well in social work, or areas that you think collaboration could use some work with certain areas, certain healthcare fields, certain areas in general? We don't have to get too specific.
Well, it's funny because the business element of healthcare really cuts through the client-centered piece. Like, I was just reading this fabulous book about last chance couples therapy, and it talks about therapeutic palette, and it pulls from all the different wonderful modalities, the postmodern, the modernist modalities. And one of the things that he said in it was like, it became so competitive. I'm a this modality therapist, or I'm a this kind of therapist. And it's like one size doesn't fit all. And really, seasoned therapists will pull from all different modalities and use different pieces from each with different clients at different times. And so we have to, being client centered to me is like, well, if I'm only trained in one approach, but you need a different approach, then am I going to convince you to use this approach, or am I going to say I do things I don't do and then go and learn them? It's healthcare. We're dealing with people's illnesses here. So, having worked in hospitals for 12 years, there's no, Ontario, there's no competition there, right? It's so collaborative because naturally there's no difference whether you take it for yourself or whether you work on that team.
Mm-hmm.
And I think that people are very, they love the term client-centered care. To me, what that means is the client is an active part of their care, and what's best for the client is what the plan becomes, not what's best for anything other than what's best for the client. So referring a client to another provider who might have more expertise in that area is client-centered. Recognizing the client's discomfort with one team member and being bold enough to recommend a change, even if it comes a hierarchical model where the referral came from, who you're going to upset. That's a client-centered approach. Being mindful of clients' funds and spending of their money and what their money is being utilized for, and engaging them inside. They're signing a treatment plan. They better sure be reading what they're signing. They better sure know it's their money. That's client-centered. So I think when the industry feels competitive, I don't know how it can also be client-centered. I think a collaborative approach works best when people are academic in their approach, where they kind of started out in healthcare, not necessarily as a business person, and have that training behind them. And I think it's, of course, personalities get along better, two people that are able to recognize the value of the client-centered model will work probably better together. I think the best approach is when people can just hear each other's points of view and have the skills to manage the anxiety of trusting other people to do their job. Because if we don't trust other people on the team and we think we know better, even if it's not our scope, I think that's where it gets really tricky.
Absolutely.
And then the client pays for a lot of time for this extra collaboration consultation because of the lack of trust. Mm-hmm. So it works best when people stay in their lane, do their job the best they can do, but trust the people on the team to do their job as well.
It's interesting because you reminded me of a conversation we had previously where I asked you, should folks be looking for a particular social worker for them who maybe specializes in a certain area? And you gave a kind of similar response. And so it's interesting that even the new things you're reading are supporting the things that you already are saying. So it's so interesting to see this.
Yeah, I mean, it's funny. So that is true. And you'll always get the same answer from me, because this goes back to like my training. I mean, I remember when I went to my interview at social work school and they said, what population don't you want to work with? And I did not want to work with intensive inpatient psychiatric. And that's where they put me. And they said, we don't train you to be a social worker with palliative. We train you to be a social worker with any age, any problem. So yes, we are helping professionals that can work with any age, any problem. If somebody calls me and says, I've been requested a lot lately for eating disorders, they're on major rise. I don't treat eating disorders. It would be irresponsible of me to treat the eating disorder. I can certainly work with a family to help them support that person better and more effectively with a more gentle approach, help them trust the professional that I'm guiding them towards. Some support's better than no support, even if it's not the specific support. But I do think it is very responsible to say, to state your limitations and state what you can do and what you're not able to do.
It's great because I really do see like the role of a social worker as such a guide. They really help folks through so many different types of situations. Some of the professionals we've spoken to have very specific areas that they're going to help you in because they're helping with maybe a neurological or a very specific disorder, where social work isn't that. They're going to help you in anything that you may be dealing with in life to help support you get to where you want to be.
Even to navigate, to find the right person, right? That could be the best help that we give somebody. We're not treating the problem, but we're certainly helping to be that witness and support them and we're expert resourcers. We're the best at resourcing. So we don't just give out a phone number. We lead them by the hand to the person that's going to help them.
When you talk about collaborative models, it's really kind of the pinnacle of what I see, because you have to be able to collaborate with anyone and know really what resources are available in every area. Like the things that happen in your mind must be incredible, because the way you have to map out these journeys for folks
but that's what it
is incredible.
It's a map. It's just one step at a time, one foot in front of the other, and taking your steps carefully and slowly, knowing what it is you're looking for, and helping them to trust themselves that, if you have a difficult relationship with a provider, or you have a distressing response, trust that it's just a person, and there's no guarantee that a professional will not be triggering in some way, and that's okay. It's not always the right fit, but you want to empower people to listen to themselves and trust themselves and not be taken led blindly, because I think that that's a big risk in our industry, that there's a lot of clinics that are quite costly and they promise a tremendous outcome from complex services that aren't always evidence-based. So we really want people to trust themselves and not build a connection where I'm the savior, trust me the most, or you don't want to build that alliance that it's dependent. That's too enmeshed. That's too extreme, because we want to set people up to leave us and transfer. We're just people coming in and out of their lives. So the relationship has to be tempered like that. And when I see providers having a connection with a client that is so high level, and they're texting or they're WhatsApping and they're in touch all the time, to me, that's a red flag.
Yeah. And, you can't really become codependent on a provider that's not meant to be a person in that role. And you kind of alluded to it. It can be expensive. So I think this is a great time to highlight that social work is something that is out of pocket generally. And so it's not something that folks can maybe set up forever. It's something that they're going to set up for a time to hopefully gain these skills to move forward.
Yeah, work ourselves out of a job. I mean, the idea is not that you have therapy for the rest of your life every week. And anyone, there's future care costs. You have to really have a discerning eye when you look at them and think, what's really realistic here, right? Transitions, definitely. Unexpected crises, definitely. But typically, you set people up with skills that they can use and resources that they can refer back to. That's a huge thing. It can't just be my verbal, what I give you verbally. It has to be something that you can, like a map to use on your own to navigate, or at least be able to say, what would Eden say? What would Eden say? So then they can, you can kind of reduce the amount of time that they need that support.
Just because we're kind of getting near the end of our time together, I would love to ask you, what do you think is one major misconception in social work? I know there are many, but if we could pick one, what do you think the big misconception is about social work?
I mean, I think that when it comes to family work, social workers are misunderstood as child protection or looking for reasons why the children might not be safe in the home. That's something that I've been faced with when working with families. They've been frightened about that. I mean, that's just a misconception with families. If I had to pick one, I mean, I don't know, insurance companies think we're not regulated. That's a big misconception.
Absolutely.
Yeah, I think that maybe we do the same thing as psychology, but people would rather a doctor. That's a big misconception. That we are friendly visitors, those are kind of the most significant pieces. Like, I work with insurance companies, right? So my job is always to educate them on our value and our worth. So that's where but when I worked in child protection in the NICU, sick kids for years, the biggest thing that came to me was, you can't come into my life because you're going to see what you don't think is safe and destroy my family. So it depends kind of what you're working in, where the big misconception affects you. But I think the psychology piece, that's really important. We do the same thing. We don't. We are not the same by any means. We can work beautifully together. We have different roles. Yeah. So those would be the big ones.
Yeah. And I think that we kind of touched on them throughout as well and kind of debunked them, which is great. Great, because I think that it's really important that folks understand the role of a social worker and how it can be utilized in, as you said, different phases of life. It doesn't need to be something, I'm going to get a social worker and we're going to work together forever, but I'm going through something and I need help.
That's right.
That's great.
Right. Yeah.
And so if I am going through something and I need help, how would I find a social worker, Eden?
So there's findasocialworker.ca is through the Ontario Association of Social Workers. So social workers in private practice can register on there. So you can search by location, by problem, by language, by name, which is a great resource. So that's anyone who's in private practice would probably be on there. Social workers, a lot of them are on Psychology Today, which is a website that has a combination of different kinds of therapists, but social workers primarily would be on findasocialworker.ca. And there's also the Trauma Resource Directory that Thomson Rogers created years ago, and it's a great website that has all the providers that work in the industry, the motor vehicle industry in Ontario, and a lot of them would do private work as well. So you can search with the same criteria. And yeah, just trust yourself to do a little screen on the phone. And if you can't have that screen, I think that's your answer. And if the screen is not comfortable, I think just be discerning. There's a lot of providers out there, and when you find the right one, it can really open all the doors of possibility to see the world differently. So
that's great advice as well. About how simple to start such a big journey with a phone call.
The relationship is everything.
Yeah, absolutely. Well, thank you so much for chatting with us today about the life of a social worker and how that can be helpful for folks, and the way a social works in that collaborative model that we're really trying to highlight and share with folks, and encourage other workers to work in that model as well. So Thank you so much.
Thank you. Nice to see you again, Courtney.
Take care.
Okay, bye. Yeah.
Join us next time as we continue to navigate the complex world of healthcare, where transparency and honesty are at the forefront, here on Breaking Barriers in Collaborative Care. Thanks, Eden.
Thank you so much. Take care. Bye.